Today I'll be speaking to you all about childhood cancer. However, before I get started on childhood cancer, it's very important that we all understand what cancer is. So what is cancer? The human body is made up of a variety of cells. These cells are produced by an existing cell copying itself and splitting to produce two new cells. This is called the cell cycle. When these cells continue multiplying, even when the body does not need them, what usually happens is a mass or a growth occurs, also known as a tumor. Now, tumors can be either benign or malignant tumors. Benign tumors are often thought to be non-life-threatening. However, malignant tumors cause damage to various tissues and as a result are life-threatening. What is important to note is that different cancers have features in common, but cancer is not a single disease and there are many different cell types. Now that we all understand what cancer is, let's talk a little bit about childhood cancers. Childhood cancers is the term used to refer to cancers that most commonly occur in children between the ages of 0 to 15 years old. There is no known cause for childhood cancer. Globally, over 250,000 children are diagnosed with a variety of cancers annually. In the last 20 years, the incidence of childhood cancers has increased by 29%. Overall, however, childhood cancers is the leading cause of death amongst children, surpassing AIDS, asthma, as well as cystic fibrosis combined. The most common cancer found in children is leukemia. Leukemia is a cancer of the blood cells, which is characterized by a disorder of the bone marrow. Early symptoms may resemble flu, but should not be neglected. Other warning signs for leukemia may also include excessive tiredness and bruising, breathlessness, enlarged lymph glands or spleen, abnormal bleeding, slow healing of cuts, abdominal discomfort, weakness and fatigue, swollen and bleeding gums, blue and black marks for no reason, persistent infections, pain in the bones or in the joints, paleness, persistent fevers, weight loss, small red spots under the skin, and pathological fractures. Other common cancers found in children are lymphoma, cancer of the retina, cancer of the kidney, cancer of the nervous system, as well as cancers of the brain, otherwise known as brain tumors. 98% of cancer survivors suffer from a chronic health condition by the age of 45. This may include pulmonary, hearing, cardiac, and other problems either related to cancer or the cancer treatment they had received at some stage of their lives. Some tips for parents to look out for. First and foremost, seek medical help for persistent symptoms that won't subside. Secondly, check your child's eyes. Check for white spots in the eyes, if there's a new squint developing perhaps. Check for eyesight problems, for sudden blindness, and bulging eyeballs. Thirdly, parents can also look out for body lumps. So check the abdomen and pelvis of your child, head and neck, as well as the limp testes for the young boys, and glands must also be examined. Fourthly, parents can take note of unexplained fevers, loss of weight and appetite, paleness and fatigue, easy bruising or bleeding. Fifthly, parents can also take note of complaints of above normal aching. This is for the bones, joints, and back. Easy fractures as well. Lastly, note neurological signs. These include changes in behavior, balance, and gout, headache with or without vomiting, enlarged head, as well as an investigation of the vitals is also necessary. Lastly, children, cancer is not your fault. Cancer is not contagious. This means that you can't get cancer from somebody else and you can't give somebody your cancer either. Although there are currently no cures that exist for cancer, cancer can be treated and it can be managed, and you can lead a full and fulfilling life even after a cancer diagnosis.